Hello, my name is Erica, and I'm a third-year nursing student. The purpose of this video is to give you a brief overview of how to prepare efficiently and effectively for your scenario testing. Have you ever blanked when you walked into a test? It can happen, especially if we rely too much on cramming at the last minute. You must prepare for a skill-based scenario test. There are some scenarios, like those based on communication, that are more about alert behavior. Skill-based scenarios, on the other hand, depend more on your memory of a specific set of procedures, and therefore require a clear plan for preparation. In this video, I will review a proven plan for success that will help to prepare for your scenario tests, different strategies you can use to help you remember important information, things to remember in the moment so you get the best mark possible, and why our scenarios are recorded. Studies show that when students are unsuccessful academically, it is almost always due to lack of effective study skills. It's not because the student lacks the ability to succeed. Therefore, remember, you can do this. As recommended on ustudynursing.com, a proven formula for success starts by believing in yourself. You need to visualize your success. Once you believe that you can do well on your scenario test, create a SMART plan for attaining your goal. SMART plans are specific, measurable, attainable, realistic, and time-sensitive. For more help creating SMART goals and objectives, please see the SMART Goals video. Once you have a plan, all that's left to do is take action and start working towards your goal. Even if the actions you take are small, they will all help add up to your success. Readjust your plan a little as needed, but don't procrastinate. For example, if you plan to study a half hour on the neurological assessment, but you aren't quite ready to do so yet, don't just skip it in general. Find something else you can do to help prepare in the meantime. Even 15 minutes at a time all adds up. Yes, you are responsible for knowing the health assessment and physical examination of all the body systems. Not just as a student, when you graduate too. While this may seem overwhelming, it's not that bad when you learn it in pieces. There are lots of different approaches to remembering the information. Find what works best for you and use it. The key here is to start early. If you start as early as possible, it gives you more time to retain information. Spacing out studying has been found to dramatically increase recall and retention. Retention is important since you will need to use the assessments again after scenario testing. You will even be tested on it again. It is recommended that students make their own personalized cue cards throughout the semester to help them become familiar with the assessments. You can then use these cue cards to help you study at any time. You may even want to make something that you could store on your phone. Who knows when you'll find a small amount of time to fit some studying in during the day. You might find some time while you're on the bus, between classes, or on your breaks. The longer you allow yourself overall for reviewing the assessments, the easier it will be to remember and recall them at scenarios. Allow time for studying. Remember, some is better than none. Even 15 minutes studying at a time will help you in the long run. You need to be sure to review all subjective questions for each assessment and all steps of the objective assessment. It is shown that practicing or rehearsing the scenario is a helpful tool that puts the student in the lead role that they will have when in scenario testing. Using mnemonics or rhyming songs has been proven useful in assisting students to retain important information. Create your own mnemonic device if this is something you think will help you to remember a part of an assessment. You can also use pictures, diagrams, flowcharts, or other study tools. If you are not sure what to try, the Learning Center can help you find strategies for studying and retaining information. I used to practice on a teddy bear or family member. I would repeatedly go over the assessments until they felt as natural as possible. The repetition really helped me to remember the order of each assessment. When it's time for your scenario, there are a few things you want to keep in mind. Remember, a percentage of your grade is based on your nonverbal communication. Marks are allotted for professionalism and the way you interact with your client, as well as for your efforts at acting as a client for your partner. Keep in mind that you will also need to complete documentation following your scenario, so be sure to listen to your client. When interacting with clients, be friendly and respectful. Always remember to greet your client and introduce yourself. Always perform hand hygiene and provide for privacy. Explain the assessment so the client understands what you're doing. The nursing process begins with assessment and is a key component in directing client care. Assessment includes an interview, health history, physical examination, and functional assessment. The health assessment and physical exam create the basis for the client diagnosis and set the foundation for your future learning. Always assess clients from least invasive to most invasive. This means starting with subjective questions in the following order: a symptom analysis using the PQRSTUA acronym, a past health history, a family history, and a functional assessment including relevant lifestyle practices. Begin the objective assessment by obtaining a set of vital signs. Then, continue with the focused physical examination using IPPA acronym, inspection, palpation, percussion, and auscultation, depending on the body system being assessed. Do your best and keep in mind that with experience and practice, you will begin to feel more comfortable and interact more naturally. Videotaping scenarios benefits both students and the professor. All scenarios are videotaped to assist in grading purposes, quality assurance, and are only viewed by the professors involved. Students are able to review their taped scenario to enhance their learning at any time. Also, in the event of a discrepancy, the video is a great tool to review. Videotaping can be intimidating. However, when you are in the room, try to be in the moment. Try not to notice the camera if possible and stay focused on your assessment. It's harder said than done for some people, but remember, it's not like you will end up on YouTube. The video is only there for review if for some reason you feel you need it. I just wanted to remind everyone that you're not alone in feeling nervous or overwhelmed by your scenario test. It is intimidating to be closely observed by your professors when completing an assessment. But remember, you probably know more than you don't, and if you can get started studying early, you're almost sure to get a good grade. I remember feeling as though nothing else mattered the week of scenario tests. I was feeling nauseous the day of the testing, and I was thinking, how can I be expected to know all of these assessments? I was like a machine trying to memorize and understand them all. And it worked. Somehow it all worked out, as most things do, and you will be surprised on how much you retain if you have put forth the effort. So although your experience is unique to you and your situation, you're not alone in feeling nervous or stressed. I always find that deep breathing and staying positive helped keep me focused. Studies show that the use of deep breathing and positive self-talk before and during a test can help reduce blood pressure and anxiety levels. It may sound silly, but seriously, give it a try. To all my fellow nursing students, I know you've got lots of other work to complete. But if you can dedicate some time to starting your studying early, your scenario test can be easy marks. Like an open book test, you already know what content is going to be tested. Plus, once you study for this, you are well on your way to rocking your final exam. I hope you will find your own way of effectively preparing for scenarios, in which case, I just want to say, you can do it. Thank you for taking the time to watch this video. Let us know how it has helped you and what else you would like to see by commenting below. Don't forget to visit youstudynursing.com for more studying resources. You can even subscribe to receive updates about new videos and posts. Thank you.